Okay. Nola in the building. Hey everyone, welcome to our Pull Up a Seat. It's so great to have you all here. This is our first one of the year, and we're excited to be able to have this group present to be able to share and talk about patient advocacy and the importance of that as it relates to policy, specifically, and TNBC, triple negative breast cancer. We have an incredible group of women here who are going to share their stories with you, and look forward to this being an interactive conversation. Please feel free as I share some information or as they share their stories, if you have any questions, please write that in the chat. And we will definitely have a chance and opportunity later on to be able to discuss that. Just to give you an update or what the agenda is for today, I'm going to do an introduction, which I just did, welcoming you all, setting the stage. I'm Shonda Cooper. I'm the Chief Program Officer here at Tigerlily Foundation. It is my joy to be a moderator for this. It's I really enjoy being able to engage with patient experts and being able to have these conversations and being able to facilitate that space for that. So excited to be able to moderate. We're going to talk a little bit about Pull Up a Seat for those if this is your first time joining. And then I'm going to dive in a little bit more into the power of patient advocacy. And then I'm going to pass it over to our lovely ladies to share about their experiences and their stories. And then we'll have breakout sessions where everyone will be able to engage with our patient experts in a more intimate setting, to be able to discuss more about advocacy as it relates to policy at the state, local, and federal level, as well as seeing what actions we can take towards moving the needle forward and really making sure that we can get some legislation passed as it relates to TNBC and other areas that can help to support patient care. So we'll come back from that around 12:05-ish to come back and hear back from our patient experts. They'll share about one or two of those takeaways that they received from the breakout room, and then we'll have some audience time for Q&A and take it from there. So again, excited to have you all here. 5 agreements. I ask you to monitor your airtime. This is probably the most that I'll be speaking during this time. So monitor your airtime. Please speak your truth. Speak from your own experience. Lead with curiosity and not judgment. And most importantly, please keep this space safe. Our why. Tigerlily, we are an organization that's been in existence for 16 years now. It was founded by Mama Karma, who also has triple negative breast cancer. And really, because of her journey, she made a promise and asked God, if he spared her life, that she would help to dedicate hers towards educating, advocating, and empowering young women before, during, and after breast cancer. She was only 32 years old, and that has been the charge. That has been what we've been doing, and we're so excited to be able to honor those who have participated in this, who have been a part of that advocacy journey, and sharing their stories. On the left, we have a picture of Chantel Randall, Shantae, who was a big part of our Tigerlily community, and who was a stalwart advocate and shared and continued to push towards change. And so we honor her. We honor those who are continuing on this journey, those who have transitioned but are still here in spirit. And just a little bit more about Pull Up a Seat. We have No More Disparities and Pull Up a Seat. Typically, we have a No More Disparities where we have a unrecorded conversation where we have a forum. It's facilitated forum by Black women to have conversations about topics as it relates to barriers to care, health, and equity, really looking at the solutions. Yes, we have a space to talk about and voice our frustrations. Also, what can we do to make it better and change that and push the needle forward? And that's where PullUpASeat comes in. So this is our conversation where it's co-hosted by Black patient experts and medical professionals to come and share about topics ranging from racism to policy advocacy and how we can make a difference in that space. So a little bit more about Tigerlily's journey, just highlighting a few of the programs that we've had over the past few years, I would say. In 2019, we participated in at SABCS, which is San Antonio Breast Cancer Symposium. It's one of the largest symposiums as it relates to speaking about breast cancer globally. And we were able to bring together the largest number of Black women to that conference to have a fireside chat about health inequity and disparities. It was through that we launched with a group of other women who were also part at that event, the Inclusion Pledge, which is to ensure that Black women have a seat at the table. There was a conversation on metastatic breast cancer, and there were only white women on the stage. There weren't any Black women. And those who were in the room, there were about 200, took a pledge that this would be the last time that would happen. And so we really have pushed towards making a space and holding stakeholders accountable through our Inclusion Pledge. We have over 12,000 signatures, over 80 organizations that have participated so far and made commitments towards removing barriers to care. And so we work to support them in their mission to do that and move the needle forward. We're all about action. We launched our this No More Disparities and PullUpASeat conversation in September 2020. In March of 2021, we launched our Tiger Trials program, which was towards really increasing diversity in clinical trials. Clinical trials really can help to save lives. And we, through that program, we really work towards providing that education and the educational resources. Our Angel Advocacy program, we have some of our Angel Advocates here. We relaunched that in 2020, making sure that we were able to provide training for advocacy, policy training for understanding about breast cancer, understanding about the importance of being an advocate, as well as being able to understand about clinical trials. And we've also have our annual My Life is My Legacy video series that we share different stories that you can all find those as well on our YouTube channel. A little bit about our policy work. So we go way back when it comes to this. In 2009, MEMA helped to draft with Congresswoman Debbie Wasserman Schultz, the EARLY Act, Cancer Education and Awareness Requires Learning Young Act. It was passed again last year, and it really just showed the importance of being able to share your story, being able to share that with a legislator and try to get something that's passed that can really make a difference. In 2011, we were appointed to participate in the Federal Advisory Committee on Breast Cancer in Young Women. We've had seven, I should say, Young Women Breast Health Days on the Hill. 2015, we flew out young women to Washington, D.C. to meet over 74 members of Congress. That visit resulted in doubling the House and Senate support for the PALS legislation, which was to protecting access to life-saving screening. And in January 2020, we assembled a cohort of 20 Black women representing cities in which Black women have the highest mortality rates for a year-long intensive and immersive program that mobilizes young Black women towards outreach and impact in their communities. Like I said, 2020, the EARLY Act was reauthorized, and in March 2021, we launched our policy advocacy training within the Angels program. So just very briefly, what is triple negative breast cancer? Triple negative breast cancer accounts for about 10 to 15% of all breast cancers. TNBC refers to the fact that cancer cells don't have estrogen or progesterone receptors, and also don't make any or too much of the protein HER2. That is why the cells then test negative on all the 3 tests. These cancers tend to be more common in women under the age of 40, as well as specifically Black women who have the BRCA1 mutation. And TNBC differs from other types of invasive breast cancer because it tends to grow much faster and spread faster. And there are fewer treatment options, which is what we are here to discuss and ensure that how can we ensure that more research, more funding is going towards finding additional treatment options for TNBC. So I wanted to share with you just 2 examples of legislation that have been introduced as it relates to TNBC. The Triple Negative Breast Cancer Research and Education Act of 2021 was introduced by Representative Sheila Jackson Lee. This act was also introduced in 2020, 2019, 2018. It's been introduced multiple times, but the importance and the reason behind it is to require research and education activities as it relates to triple negative breast cancer. It specifically asks that the NIH must conduct and support research into the disease, and also that the CDC must develop information about TNBC, including information regarding the elevated risk for minority women, for the public, and for healthcare providers. And I'm sharing this as well as we continue to discuss how our voices matter and how we can make a difference, and to raise awareness to some of what has already been introduced. Another legislation that was introduced has been the Triple Negative Breast Cancer Day at the federal level. And that was introduced. However, we're trying to get stuff passed into law. So that's what I wanted to be able to sort of give you all some guidance as how we can do that. So the power of patient advocacy. Capitals are the people's house. You have every right to talk to your representative, to their staff, and to exercise your right to be able to speak to them. We have to be engaged within the process. The power of the constituent, the power of each person on here is really underrated, but it makes such a difference. You can always get a meeting with somebody when you're constituents. This is at the local level, state level, being able to talk, even district level, being able to speak with them and share what is important to you, being able to advocate and say, this is something that is occurring in my community that as it relates to, especially even as it relates to health insurance, health coverage, that needs to be addressed. And the more we've heard that, the more that patients sharing their stories make such a difference in the process of being able to push the needle forward. So as it relates to, yes, voting is important. Also sharing your story is important. And that is a part of the reason why with our Angel Advocacy program, we really help to empower women, empower our patient advocates to be able to share their stories and to feel comfortable to be able to do that within any stage and within every audience. So when you're wondering, okay, who do I contact if I do want to push or press, for instance, like I just shared with you, 2 different acts, who am I going to speak to about that? Or if I have someone to speak to. If you can convince key staffers in those offices, then that really can help you to be able to have a position to be able to push something forward. And like I said, a direct contact will take you far. Some of the key staffers that you need to contact, the legislative director is really key. Also, if there's someone that's a part of the committee staff, let's say within the district, there's someone, or there's a health committee, trying to find out between that committee staff who just identify or convince one of the members that about your story and why it's important to push that, and you're golden. Because committee staffers are like the gatekeepers. They decide what does and doesn't go up for a hearing. So that's really important. And the more that we're able to do that, the more that we can get in there and convince these members. I think another part that's also very important is inviting representatives to come into the community. Yes, the Capitol, like I said, are the people's house, but also goes both ways. Some of these representatives are they're separated from their own constituents. And so we need to invite them as well to come into the community, invite them to come to events that are being held as it relates to triple negative breast cancer, as it relates to breast cancer and health insurance, health awareness, health equity activities, so that they can see specifically what is happening. And let's call them out so that we can get some change. Again, so power of sharing your story. It's so important, relationships and being able to build relationships with local legislators. Like I said, being able to even just pick up the phone, calling them, going down. I mean, I know we're in a strange time with COVID, but if you're able to go to your local office, that means it makes a difference to be able to speak to them and build that relationship so that they know you and that they realize that the person who is, that there's a person behind what legislation that's being enacted, or that what we're trying to push forward as it relates to a bill. So introduce yourself, explain what is important to you, and why it's important, and take part in lobby days. Like I mentioned, so typically our Hill Day, we have representatives, we invite our patient advocates to come in person to the Hill, but there are virtual ones too, as well as letter writing campaigns and emails, being able to just share your story and share your voice in multiple facets. It goes a long way. So you're wondering, okay, what can I do? You're talking all these things, Shonda. What can I but what's the next step? We have our annual Hill Day next month. It's going to be a hybrid event. It's going to be April 28th, 2022. For those who are in the DMV, please, I think Lizzie is also here. She is the director of our HEAL Center, Policy of Excellence, and she is helping to organize that. So if you're interested in participating in that, if you're in the DC area, please reach out to her, as well as it's going to be virtual. So it's hybrid. So those who aren't, but you still want to make your voice heard, this is the opportunity to do that, as well as being able to learn how to do this in action. So I shared the ground rules, but now I shared sort of a framework, but if you want to learn how to do it, next month is your chance. Let's get it, let's just do it right now. So the registration I'm sure is probably being dropped in the chat as well. But if you have any questions, please feel free to reach out to our team. Now, I'd love to share and introduce our phenomenal panel of patient experts. LaMarr Funn is here, Latoya Johnson, Erika Weathers, Kellie Goss, and Se-Nita Harris. I'm going to stop sharing my screen so we can see their lovely faces at this time. And I invite, I'm going to ask LaMarr to share first, and then surprise, followed by Erika, Kellie, Latoya, and Se-Nita.
Okay, should I just start sharing now?
Sure, yeah, you can.
Wow, this is such an honor to be here today. I recently got a mastectomy as a triple negative breast cancer. I've gotten all these trinkets to encourage me. Oh, can you see it? It says spider. I'm a fighter and survivor. I was diagnosed last April of 2021 with triple negative breast cancer. I went for my mammogram. I wasn't experiencing any kind of issues as far as I knew. So my primary doctor set up for me to get a mammogram. And upon going to get the mammogram, I was called back. My primary doctor said, oh, they think they may have seen something, but just go back. It's probably nothing. And I just, on that second visit, became very emotional because I thought, I think they're going to find something, though I didn't feel anything. Well, they did. And upon finding, they said, we see something, we think it is about 2 centimeters. And I'm like, what? So then they sent me for a biopsy, and I've never been in any kind of surgery whatsoever in my life. So I was pretty scared. And upon getting the biopsy and then getting a CAT scan, if you will, it was determined that it was about 3 centimeters, the tumor itself, which was found in the upper right quadrant of my right breast. And so I started chemotherapy the first week of June, and everything just happened so fast. And so I immediately got a port, and the port enabled me a portacath, just in case someone who's listening doesn't know what that is. A portacath is where they will create an entryway like on the side of you so that you can receive anything intravenously, and that would include hydration, chemotherapy, immunotherapy, which is another word that one can obtain now for triple negative and/or breast cancer patients. I'll circle back around to that, but nonetheless, if I were to just, I think I did chemotherapy from, let's see, from June until November, and I took a Paxitol. I can't really remember the names in this moment because I'm still kind of in that fog, if you will, and just having come out of recently getting a bilateral mastectomy, which is the removal of both breasts. So it's been, thank you, Latoya said, it's Paxilactol. You can pronounce it for us later. But I have been quite like scared throughout the journey, but growing incrementally with every month, and it's definitely made me stronger. I tease my surgeon, my breast cancer surgeon, that I went from being a toddler to a teenager, because I really felt like my body failed me. And I'm a person who has been a bit of a health coach with Vitamix Corporation. I was a person who went around teaching people how to eat cleaner and utilize this Vitamix machine. And I'm a person who would eat parsley whole and put it in my Vitamix and have all of this array of recipes. And then here I am with having been diagnosed with breast cancer, and I'm going, what did I do wrong? Or why has my body failed me? But, you know, no one is exempt, and doesn't mean that eating clean or utilizing tools that are helpful for the body to operate at its best doesn't mean that trying to live that lifestyle failed. It's just, you just don't know what's going to happen when. But anyway, just to speed it up, I recently got a mastectomy, and I'm really grateful that I did it, though I was terrified about it, but I'm just happy to have gone through with making this decision, because I don't want to give cancer another chance to appear back in that area, if you will. This is my first panel, so please forgive me. I'd probably be better off with a question.
You're doing great.
Thank you.
Yes.
Oh, Thank you. I appreciate the encouragement. Because
Yes.
I'm a little wonky because I've been on some heavy medication and Tylenols and the soreness of it all. And then also trying to prepare myself mentally for that decision to remove, I'm a mother of twins and also a single and then twins. So I breastfed all of my children. So it's such a big part of any woman's femininity, but having been one who breastfed their children, it's like a big part of my memories. So I'm used to when I'm getting dressed and I see myself, I'm like, I'm reminded every day, if you will. So I was really like, you're just trying to take my breast from me. What do you want with my breasts? It's like, nobody wants your breast, lady. It's for your best health to do that. Someone asked, did I stay flat? I wish I could show you, but that would be a little bit like too much. But we could do that on the
I have
side.
to pause the recording.
I'm not gonna do it. I'm not gonna do it. But I got what's called expanders. So they removed the nipple, the areola, the nipple part, and they took the skin from the bottom and took the skin from the top, and then I have stitches going across like that, almost from all the way on the right to almost all the way on the left, if you will. So I'm not flat. I have they're stretching the skin, and I have opted, because there are a lot of options out there, if you will, or I've opted to get implants, and my doctor was fine with giving me expanders from the beginning instead of my going flat, because we had that discussion and they felt that it was an okay option for me. So just to answer that one question that I saw popped up. Oh, okay, there we go.
Thank you, LaMarr. Thank you so much for sharing that and being able to share your story as well about where you are, what your journey is, and being able to just be here. You did great on your first panel and everyone is cheering you on. So this is the first of many. Well done. Yes. So there are people who definitely can relate to what you're sharing as well. I'd like to pass it on to our next panelist to share, Erika, her story, and then Kellie, Latoya, and Se-Nita. Thank you.
Hello, everybody. My name is Erika Weathers. I am a 13-year cancer survivor. I was first diagnosed back in 2004 with DCIS. I was early on stage 1. It was only like about probably 5 centimeters, but they took my breast because of the location of it. And I ended up getting a mastectomy with a tissue expander put in me, and then getting the saline implant at the time, because that's when it was taken off of the market. But if you were a breast cancer survivor, you still have the option to do that. So I chose to go with the silicone at the time. And then I just got a lift on my other breast. And since I was ER and PR positive, I did not have to get chemo and I did not have to get radiation. They put me on tamoxifen for the recommended dosage at that time for, 5 years. I took it for 2 years because I didn't like the way it made me feel after, it was just, miserable when I was on it the first time. And I know we all know the side effects of some of these drugs that we take. And I felt that I was, I was doing better. I was maintaining and trying to live cleaner and do all the things that I was supposed to do. When you go first find out that you're diagnosed with cancer, you try to get every book that you can and read everything. And I put myself through so much, started having anxiety attacks just from reading so much stuff about it. But I'd always been a person that was that I thought I was healthy anyway, working out. But even though I was working out, I wasn't feeding my body properly. So 4 years later, my breast cancer came back in the same breast that they took. So it came back in the breast that right almost in the same location. It grew up like a little mass, like a little nipple. It was really weird. But because they didn't give me the radiation the first time, as soon as you get closed back up, it could start growing again. And that's exactly what mine did. And then with me stopping to take the tamoxifen after 2 years, I guess it just all developed again. And I redid everything all over again, and tissue expander, implant back in and out. And this time they gave me the radiation, and I went back on the tamoxifen for another 3 years, because as they say, it's just to be in your body. So they didn't add another 5 years. They just had me do another 3 years. And the amazing thing this time when I went through it was that the tamoxifen was like I was taking a water pill. I didn't have any of the side effects that I had before. But when I was first diagnosed, I was 34. And then when it came back, I was 38. So I don't know if age had anything to do with it or what. So I took the tamoxifen for those 3 years. I went through the whole process of the reconstruction surgery again and put all of that in there. And then this time with the radiation, my breast, of course, our tissue from the radiation wasn't as supple as it was the first time. So my scarring was really much worse than it was the first time. The first time I had just gotten like one of those little nipples, putting back a tattooed nipple on, where they go down in your bikini area and just take some skin out of there, and they made like a nipple out of it. But over time that nipple would get flattened out. So it's really amazing from when I started to where we are right now, at least with some of the better treatment plans, the better options to get nipple replacement, the 3D tattoos and all of that kind of stuff. So the second time around, I didn't get any nippling back up there or anything. I went and I got a mastectomy tattoo. And to tell you, it was just amazing, because like what LaMarr was saying, you look at your breast and you don't even like looking at yourself. So how sometimes can you think your mate's going to be able to share in that if you're not even happy with yourself? So I got a tattoo. I ended up, just the whole story of that is just a whole nother issue I won't go into, but the universe opened up for me and I got a free tattoo on my breast. And it really changed me. I mean, I was already living my life. I knew I was going to be cancer, even though it came back a second time. I knew it wasn't going to come back a third time. So I always had that positivity, and I always think your mindset is very important. But now I feel, I'm single, and I'm fine with being single. I love myself, and if someone comes along and adds to my life, then that's just great. But in the meantime, through all of that, I wrote a book about my journey and how I think I maybe got breast cancer. And I'll show you I just want to show you real quick. This is what my breast looks like. So this is the tattoo, and this is my book cover. So it's called Free Me to Be Me, and it's just my journey with how I how I got it and where I'm at in my life right now. I recently just became an angel advocate with Tigerlily, and I also have done some work with Young Survivors Coalition as a navigation advocate for them, and I also work with my Son Matters as an ambassador for them as well. So I am in my survivorship, and I did do some hill work before going up there for the cancer, the survivorship bill, because even though I am cancer free, I still go to the hospital twice a year for my mammograms and my breast MRIs, and because I still have to make sure that it doesn't come back, and I still have to be able to take these tests, which are not cheap at all. I mean, of course, the mammogram is free, which is great. And I also wish that the breast MRI would be free, just for preventative medicine to be able to go and do that. So I am still always cheering for that survivorship bill. And I just want to be an advocate for all women with breast cancer, because we know there's all different kinds of breast cancer out there. And we all go through different experiences and, the different treatment plans that we have to go through. And there's so many options for people who want to take the treatment and who don't want to take the treatment. I want to be an advocate. I want to be a voice. I want to be able to be somebody that anybody can just come to and talk to and just ask my experience and get my opinion, or help them with their going through their process and what they need to do for that. So glad to be a part of this group of lovely women. And I hope that I can help to be a change.
Yes, you are. You really are. Thank you so much, Erika, for
Thank you.
sharing and all the information. Please drop your book in the chat, because there are lots of us who are interested in getting a copy of that and putting it up. So please share that. And just what you were sharing about too, as it relates to survivorship, that's something that we're going to be discussing at our survivorship and the impact of that survivorship bill at the in April. So
right, because Debbie was also a part of that when I went up there, because she's also a cancer survivor too. So that's very dear to her heart.
Yes, exactly. So thank you so much.
Thank you.
And we're looking forward to continue to put comments in the chat and everything as we continue on with the stories and having these patient experts share their stories. I'm going to pass it on to Kellie.
Hi, everyone. Good morning. I'm Kellie from Atlanta, Georgia, and I may be the only person on the panel that has not had cancer. I have lived with the fear of getting cancer for most of my life. My mother is a 2-time breast cancer survivor, and my baby sister, my younger sister, has also had breast cancer. And so based on the likelihood of me getting cancer myself, I was able, through my genetic screening, I learned that I was, within my lifetime, I had a 75% chance of getting breast cancer and an 80% chance of getting ovarian cancer. And so based on the results of that test, I decided to have preventive surgeries. So in February 2018, on the same day, a 12-hour day with 3 different surgeons, I had a hysterectomy and a mastectomy. So I had nipple sparing double mastectomies. I follow the same route as I think that LaMarr and Erika shared, where I had both of my breasts removed, and then I went from expanders and now to mastectomy. The only surgery that I haven't had yet, and likely will do so in the near future, is can't even think about it, when they do the fat, because my breasts are they look like implants, like you can see the ripples and you can see the dimples. And so I haven't had my fat sparing surgery just yet. So that's the final surgery that I haven't had. But my breasts still look like my breasts, but like many of you shared, I suffered the same fate of where I thought that, oh my God, I've breastfed my daughter. These are the breasts that look amazing in my sorority sweater. And, this is the first thing that people see and know about me when I step into the room. And so I struggled with that, about whether or not to actually have the surgery. And secondly, when I went online to figure out exactly what I wanted to do about the surgeries altogether, I didn't really see anyone that looked like me that was having the surgery. And so then it made me feel kind of like, this isn't something that Black girls really do. Like, this is it's a white girl thing. I just didn't really feel like it was just, and even with genetic testing, I remember 5 years before I actually had my genetic testing done, based on, again, my mother's history with breast cancer, my doctor had recommended that I get genetically screened. And I was like, oh, I know what that is, right? The Angelina Jolie test. And because that was the name typically that people associated with BRCA and getting genetically screened, that's really the only name that people know. And so he shared the information with me. He gave me the pamphlet, and it sounded like a great idea. And I told him, I'm going to think about it. And so I thought about it for 5 years, right? And so I had an appointment. It was an OBGYN appointment. And this time, the young lady that was responsible for seeing me, she was a little bit more persistent. And so she said, well, you could get the genetically screened. I could take your blood test today. And I was like, oh, I got stuff to do. I'll come back to do it. She's like, it doesn't take long. We got time. I'm like, oh, I'll get it done the next time. She's like, it takes 2 seconds. And I'm so grateful that she was persistent, because had she not been, I wouldn't have known what my likelihood with those percentages are. Because even, you know, a lot of people think that having your breast cut off or having a hysterectomy based on numbers is a big deal, right? People don't typically normally do that. People see that it's kind of extreme. But having those numbers really is a game changer, because it made a difference in how I was able to navigate that space. So initially, once I got those numbers back, when I knew what the probability of me having cancer within my lifetime, I was like, okay, so I'll just get increased screening, because you can do that as well. And so what that looked like was, at the top of the year, they would do an MRI. And then at the bottom of the, the midpoint of the year, they would do a mastectomy. And so I would just get those done with more frequency so they could stay on top of it. But that still doesn't prevent me from actually getting cancer, right? And so I was still having the same sense of living in fear. I was had the same sense that I couldn't shake for most of my life, is that sense of just waiting and waiting and waiting on cancer to find me, and then reacting based on that probability. And so it was a really hard decision, but I decided to have the surgeries. And I'm so glad that I did. Initially I thought about all the stuff that I would lose, my breasts, and, you know, how would I be affecting my quality of life? Like, Kellie, you're having this surgery when there's nothing really wrong with you. And then what if you have this surgery and it upsets the balance of everything? And so I really struggled with that. And I struggled with the fact that not very many people understood why I was doing what I was doing. It wasn't really well received. And people had really strong opinions about that. And so, you know, I had a lot of people that would tell me, well, you might not ever get cancer. And, you know, if you get cancer, you just pray about it and God will take it away. And, you know, so I struggled with the whole faith-based element of it. I struggled with what people would think about me. And so finally, I just tuned out all the background noise. And I made the best decision that I felt like was a thank you. I made the best decision that I felt like was the most important and scariest and necessary decision for me and my family. And it may not be the best decision for anybody else, but for me and mine, it made the most sense. And so it took away that fear that I had been having for most of my life. And as a matter of fact, me and my sister got tested at the same time. And like many of us, she was like, no, I'll just, you know. And so after we were both tested, my sister actually got breast cancer, and she had the same probability and likelihood that I did. And watching my mother go through that experience with my sister, with radiation, and we were all just rallying behind her and supporting her, and seeing the pain and watching my mother go through that, I knew for certain that I had made the right decision, because I couldn't bear to put my mother through that again. And so that's my story. I'm Kellie, I'm a pre-viver, and I haven't had cancer, but I'm cancer adjacent, and I'm happy to be here with you all and sharing my story.
Thank you, Kellie. Thank you so much for sharing your story and just being here, and your vulnerability, and being able to share about what you've gone through, and being a pre-viver, and what you did, what you took, you know, taking that ownership and doing what was best for you, and for your family. So we just thank you. Thank you so much for being here. I'm going to pass it on to Latoya.
Good morning, ladies. Good morning, good morning, good morning. I'm trying to recuperate from Miss Kellie. She got me a little emotional right now. That was very inspirational. And I haven't, you know, I'll be honest, I haven't, you know, really heard the testament from a pre-viver such as yourself. So that was very moving, because I didn't realize the emotional and psychological aspect that the pre-vivers go through as well with the gene mutations. So thank you for sharing. I really appreciate that, really, truly. So my name is Latoya Johnson. I'm from New Orleans, Louisiana. I live in the DMV area. mother of 3 little girls under the age of 7. My oldest will be 7 next month. So I'm busy. I have a loving husband that I would not be able to survive without. I'm an emergency medicine certified physician assistant. I've been practicing for the last 10 years. I was diagnosed with stage 3C triple negative breast cancer, invasive ductal carcinoma at the age of 36, July of 2021, while I was at work. I found out about my diagnosis through an email. Did not have the luxury of having, at least a phone call or, an inpatient or in-person consult, because there's a federal law, and I didn't know about this until after the fact, but there's a federal law change that when patients' results are available, that they have to be released into patient portals. So it's a good thing, and it's also a bad thing for it to release very sensitive information like that into a portal. And I can just imagine, I know how I felt, so I can just imagine how someone who doesn't have a medical background would feel in trying to understand this information, because it was even hard for me to process it, to receive information in such a fashion. So on that note, I'm going to be I've already making some mental notes on how I can try to, work in legislation as far as getting some results kind of filtered out that should not go into patient portals. Things like cancer and HIV, that should not be released into a patient portal without a physician telling you about it first. So, yeah, but that's a side note. I am 2 weeks post-op today from, 3 weeks today from double mastectomy. I got my drains out yesterday. So I'm healing okay. I've had a couple hiccups, but I'm still pushing through, and I didn't want to miss this event today, even though I'm not feeling 100%. But I'm all about advocacy and, hoping my story can help change someone else's life. But when I was originally diagnosed, I did find a lump in around, I don't know, maybe about a month before I had the mammogram done. And I did not think that anything of it, because I'm 36 years old, young, otherwise healthy, or at least I thought I was young. I'm a little fluffy, but I'm like, okay, I don't have diabetes, high blood pressure, none of that stuff, just some extra fluffiness from having 3 babies back to back, But anywho, so yeah, so I felt the lump, and I was very naive about it. I thought it was this is just like a milk cyst, because I breastfed all 3 of my children. And at the time I was diagnosed, I had an 18-month-old. So I had just stopped feeding her like 5 months prior. I fed her all the way until she was 13 months old. Okay. So I'm thinking that this is just like a milk cyst, and actually on my mammogram, I was actually misdiagnosed on my initial mammogram. My initial mammogram stated a galactocele, which is a milk cyst, and come back in 90 days. Yes. So thankfully, there was another radiologist in the radiology world. There's overreads where another radiologist will look at some things if they're flagged, and sometimes it may not be flagged. So I have very dense breast tissue, So anyway, thank God for that other radiologist who called me back 2 days later and was like, nah, it looks a little suspicious, we should have a biopsy. And my heart dropped, because, no one likes to get that call. And I had the biopsy, like I said, fast forward, getting the pathology report that says grade 3 triple negative breast cancer was devastating for me. I had to leave work. I was in the middle of taking care of 2 patients. Like, one patient I was putting a cast on an ankle, and the other patient I was draining the laceration, doing the laceration repair on the face. So I couldn't even finish my duties at work, so I had to leave. And when I pulled up in the driveway, I worked 12-hour shifts. So it was in the middle of the day, like 4 o'clock. I pulled up in the driveway and my husband just like passed out in the driveway. He knew when I pulled up that there's no reason why you should be here. He knew that it was, cancer diagnosis. But anyway, I started chemo August, going through this whole roller coaster and processing this information, and started chemo in August. I finished chemo. I did the standard neoadjuvant chemo, the adriamycin, the Cytoxan, the paclitaxel, and finished January 5th. I'm just not finding out now that, well, not now, but Keytruda should have been added to my neoadjuvant chemo. So I'm really upset about that right now. And this is the reason why, regardless of your background, your credentials, whatever it may be, you have to advocate for yourself. You have to advocate for yourself. Because I asked my oncologist about it and he kind of brushed it off. And I was doing research about it. When I heard about it around the time of the San Antonio Breast Cancer Symposium, because I was actually an attendant and a virtual attendant. And I asked him about it and he just kind of brushed it off. And I'm dealing with that emotional aspect of it now, because I'm blaming myself a little bit for it, partially because it's like I should have known better. Like, I'm a medical provider too, even though I'm not an oncologist. And I was the patient, that I took a step back from researching so much data online in the support groups, because it was causing me to have so much anxiety that I have never had in my life. Just reading about the recurrences and complications that people had, and people posting that, their family member died from breast cancer. And I just was like, okay, in order for me to get through this, I just need to be the patient right now. I don't want to be the PA. I stopped researching stuff, and I blame myself for that aspect, because I felt like if I had continued doing that, then I would have definitely advocated for myself and told him, no, you need to add this Keytruda now, or went somewhere else to get it. But God made it the way he made it. And at this point, I'm just trying to figure out, how I can get this life-saving drug now, and I'm going to get it. And if anyone else is in my position, there is no data to support getting Keytruda after you've done your adjuvant chemo. Keytruda is an immunotherapy. So there's no data to really support it at this point. So it'll be kind of like investigational if you get it after the fact, but it really also depends on your oncologist and your institution or whatnot. So needless to say, that oncologist was fired, because you were medically negligent. You cannot be in charge of my health from this point forward. So ladies, if you're not vibing with your oncologist, if they're not giving you reasonable explanations, or you're just not vibing with them, if something feels wrong from the very beginning, trust your gut. There are plenty of other oncologists out here. At the end of the day, they work for you. And just because they may have a certain letter behind their name, it doesn't mean that they mean you well. And this is the reason why we have the health inequities in this country globally is so terrible, because I feel like at the end of the day, if I wasn't a woman of color, he would have done something. He would have introduced that Keytruda for me, because there was no reason why he should not have. So, it's a battle. It's a battle, because I have sacrificed my whole in 20s to study medicine and obtain 2 degrees and devote myself to the medical system. And I'm feeling some type of way about it right now, because I feel like, okay, the medical system is failing me with that oncologist. So it's people need to understand that cancer is not just a physical diagnosis. It's an emotional, it's a mental, it's a psychological, it is a financial diagnosis. It affects every aspect of your life and your loved ones. So early detection is the key. Do not wait until you're 40, because if I had waited until I was 40, I would not be here. I would have never made it. So know your family health history. Feel your tatas, check your boobs. Do that. If you don't feel something that's right, get it checked anyway. Don't let them tell you wait until you're 50 to get a mammogram. That is not the case. Black women are being and more just Black women in general and other women, we're being diagnosed at earlier ages. So please advocate for yourself, check yourself out, know your history, talk to your doctor, demand those 3D, not just a regular mammogram, a 3D mammogram, especially for dense breast tissue. So they can really, really know and get ahead of those screenings, because early detection improves better outcomes. And you don't want to be in a situation like myself where you've had to go through chemo and amongst other things. So right now, I'm recovering from the mastectomy. I have radiation. I still have to do Xeloda and with this Keytruda. So I still have at least another year of treatment, and I still have to do reconstruction. So it's a long process, but I'm holding
You
on.
got this, girl.
You do.
I'm holding on, and I'm just, anybody who will listen to me, I will talk to them, because I just want to spread awareness about it so that I can help someone else who looks like me, who doesn't look like me. If they have breast tissue, I want to help you. It doesn't matter. So thank you for having me.
Thank you, Latoya. Thank you. Thank you for being here. Thank you for your just being incredible, for sharing, for speaking your truth, sharing about what's going on. And like everyone has said, don't blame yourself. That isn't your responsibility. And the fact that even you who have gone to medical school, I mean, you have more knowledge than the average person, and you still had to, it's an injustice, period. That has nothing to do with you. Like that's a bigger problem. And that's what we're trying to, that's what we're talking about, trying to talk about too here with the like policy advocacy. It's a bigger problem. Like you just said, you shouldn't have gotten that information. Okay, yes, the federal law that says that this information should be released through the patient portals. At the same time, though, when it's something life altering like that, can there be some caveats as it relates to that, so that you aren't in that position where you receive something like that and you don't have anything to be able to, I mean, you're traumatized and you don't have someone to talk to you through and talk through what you just saw. You're just reading something like that, and then you're supposed to sit with it for a few weeks or whatever, until they're available for you. No, that's absolutely, no, it just shouldn't be like that. So I just wanted to, keep on. Thank you for being here, even if you aren't feeling your best, but everything that you said resonated, and it was so powerful and such great advice. So I just wanted to thank you.
Thank you.
And I wanted to pass it over to Se-Nita to be able to share as well, our final speaker, and then we'll open it up for conversation. Since it's an intimate group, we're going to keep it in the main room and just discuss what we've been hearing and talking about here today.
Hi, everyone. My name is Se-Nita. I was diagnosed at the age of 37, so also very young. When I found my lump, I was in the shower and I was in denial. So I didn't go for a while to the doctor. But ironically, while I was finding my lump, I was working for an advertising agency, and we do a lot of purpose-driven work. And I was actually working on the Susan G. Komen account as I was being diagnosed. So it was very ironic. And they were basically coming up with a program to help women of color against health disparities. So that prompted me to, continue to go ahead and get myself checked out and everything. And ironically, I was diagnosed during this time. And when I originally went to the doctor, I went to one facility, and that facility, I believe for myself, I didn't have a good experience. The doctor that diagnosed me, and the pathology report that I received at first, I was diagnosed with metaplastic breast cancer, which is a 1%. And that specific one actually is not responsive to chemo. So originally, because of that diagnosis, I went and got a second opinion to advocate for myself. So the first experience that I had, I was in the doctor's room, and this is like when I first got diagnosed. And I just remember it was like 4 people in the room, a TA assistant, and it just felt like a lot, like very out of control. This is my first time being diagnosed with anything. And I just felt as if though I was a number. Like I was told that it was very aggressive, that they would have to move quickly, that I would have to get a port, and everything was just going so fast. I just felt like I just felt like it was very out of control. So I went and got my second diagnosis, and I got a very different experience. And the woman was of Indian descent, so she was a woman of color. When I had my breast exam, it was in the room with just me and her, very intimate. And then when she brought me to the room to explain the diagnosis, my brother was with me, and she went through everything line by line. And she told me from the beginning that I was going to live and live. She was going to make sure that I was going to live a long life. And so after hearing that, I knew that that was the way that I wanted to move forward. And so from that experience with her, I just decided to, they both had given me the same treatment plan, which was chemo first and then surgery, etc. But because I felt more comfortable with that specific facility, I decided to go to that specific facility. That it was around the wintertime that I was diagnosed. So therefore it was a lag in getting all of my documents. So the place that I did go with, they went with the metaplastic diagnosis until they were able to get all their reports and things like that. And once they got the reports, their pathology team, the whole entire pathology team, even people who did not even work with triple negative breast cancer or breast cancer in general, they all looked at my report, and they determined that it was not metaplastic and that it was in fact triple negative. So it was a very, very, very dramatic change in what my treatment was going to look like, because once they figured out that it was metaplastic, they decided that I was going to have a mastectomy, because that the chemo was not going to be as receptive to the tumor if it was metaplastic. So I had already decided to do a mastectomy. I had already talked to like the breast surgeon, the plastic surgeon. So I went through everything, even where I took the picture of my breast and everything. And my breast surgeon let me know, hey, there still might be a chance that we will make you go back to the original treatment plan of chemo first, but if it's metaplastic, then this is how we're going to go. So it was just a very dramatic, emotional roller coaster that I went on, because here I am, a woman who haven't had children yet, haven't been married, and I was deciding that I was going to have to, lose one of my breasts. And what ended up happening was she called me on a Thursday. I had surgery scheduled on Tuesday. And that's when I found out that it was in fact triple negative and that I didn't have to have the surgery first. And so I ended up then doing chemo first. And that is how my story went, where I ended up doing chemo first. So I did do ACT. So I did 12 rounds, because what I did appreciate about my oncologist is that that's what she recommended for me. And she said that they see better outcomes when you do the longer route, especially because I was diagnosed with stage 2 and I had a bigger tumor size. So my tumor size was around 4.5 centimeters. And so thankfully, when I started the ACT, we saw that it did shrink after the first treatment. So that was really great. And then I went through all of chemo. And when I talked to the breast surgeon and the oncologist, because of where my tumor was located, they gave me the option that I could actually do a lumpectomy. And personally, I decided to go with that option because I hadn't had children yet and I hadn't been married. And before this, I was diagnosed with fibroids and I had 2 very intensive surgeries. And I had a very traumatic experience where my lung collapsed and I had pneumonia. So after experiencing that, I didn't want to have extensive surgery. So that was the choice that I made for myself. So after I finished chemo, I did the lumpectomy surgery and then I did radiation. And when they did the surgery, I ended up finding out that there was a pea-sized amount left in the tumor. My margins were clear and also my lymph nodes were clear, but because they had that small amount, I also had to do more treatment, post-treatment, and I call it extra credit because, you know, we don't know, like if I did have cells or anything left over, it's just a treatment that they do just to make sure that it doesn't come back. It doesn't, like, if it's there, then it's gone. So I was willing to do that. And not only that, when I had my surgery 2 weeks after, the FDA approved for triple negative women for us to be able to begin our treatment with immunotherapy. And so because I wasn't offered that, my oncologist, who does a lot of advocacy work, she brought it to me and she said, hey, I want you to do this because you did not get this treatment during the time that now women are going to be doing it. So I do want you to do it afterwards. And she was very adamant about fighting with my insurance company, you know, if they had any issues, that she was going to present it to her whole team so that we could all be on the same page and move forward with that treatment plan. So that was very, very, very important to me, that even I didn't even want to do it myself, but she was the one advocating and pushing for me to do it. And she explained to me in terms of Xeloda that they do find out that this women who do this treatment do have a better prognosis, as well as Keytruda. Immunotherapy isn't new to cancer. It's been around for a long time. And ironically, I worked when I first I live in New York, but when I first moved to New York, I worked in advertising at a pharma agency, and Keytruda was one of the drugs that I worked on. So I know it's been around at least, you know, for several years. So it's not a new drug, it's just a new regimen. So I felt comfortable because it had been around for so long and so many other cancer patients had used it, that I felt as if though it was something for me to, you know, use. And immunotherapy in a dumbed down version is basically where your immune system is being trained to kill and attack any cancer cells that pop up. So I was grateful that I was able to take that treatment plan, and as Latoya mentioned, it is new, but I'm grateful that, you know, I got the opportunity, because you don't know how fortunate you are, because a lot of women before this, you know, could only take Xeloda or maybe not even have the opportunity. So I think that as we move forward with, you know, things being approved, clinical trials, more Black women being a part of those things, then we'll see improvement in the medical arena. And then also in terms of cancer in general, it's looked on as a stigma or a taboo subject, but there's so many people who know someone who has been affected by it. I think it's time for us as, you know, women of color to speak up about it and to be more involved. And so one last thing that I will share is that as I was going through my journey, because I was working on Susan G. Komen, they had offered me the opportunity to be kind of followed through my journey and be a part of their Moments campaign. And I thought it was very powerful because, as a lot of women mentioned, that they didn't see women who looked like them or young women. So I thought it was very important for me to allow Susan G. Komen into my personal space to record me and film me, because I thought that it could reach so many women who look like me, even young women who don't think that this is a disease that they can get. So it was just very important for me to do that. And ironically, I did leave my job and I accepted a position at Komen to work on their Stand for Her program. So the Stand for Her program and initiative is all about action. So they're working to, you know, help women with patient navigation, financial services, and Stand for Her actually means Stand for Her, HER, which is Health Equity Revolution. So I think it's very important for me to be a part of that journey, just starting from the beginning and just kind of seeing it out. So I'm excited to start in that arena. It'll be different from what I've done before, which is more marketing, but I think that this is a powerful place to be right now. And I think that it's urgent that we, you know, tap into advocacy and to getting things approved by the government. Biden just did the Moon Project, which is also helping cancer patients. So I think that we have the ear to a lot of people now. So I think it's just important in this day, time and age to jump on board on advocacy. So, yeah.
Thank you, Se-Nita. Thank you for sharing your story and just what you're doing now, and how, you know, congratulations on your role and being to be able to share about this revolution representation, as well as, especially like what you said, this is the time where there's more of, I think, of a spotlight in a sense with Cancer Moonshot being relaunched, that this is an opportunity for us to be able to share our voices, share, you know, and advocate more for what is happening and what we need to do in order to really address some of these needs and disparities. So it's incredible, even as you're sharing about what you experienced, that here you are, that you did, you were like marketing for this drug that you ended up having to use later on. I mean, it's just like the way that God works. You don't even understand. We don't know why he does the way that, like, how things are the way, but now that you are where you are, it seems like it makes sense in a way. But it's just, you know, just thankful that you are in the space that you are right now to be able to share, to provide this, and to be able to explain about your experience, what you've been through. Also showing about like having two different experiences of an oncologist, and having that really being able to show what it is like to have an entire team look at your results. Everybody will look at your results and be able to say, like, this is what we, you know, that's how care it should be. That shouldn't be an exception. It should be the norm, you know? And so with the position that where you are right now, to be able to share that, I just want to thank you for that. And being also able to be able to advocate for it because you've experienced it and lived it. And it's unfortunate that there's so many different, that should be how everyone's story should be on this. And that's why I think we're all working towards that should be the case. And that we shouldn't have to, depending on where your location is, even, that you have different levels of care and different access to care. And especially, you know, within our communities of color, being able to have those resources and being able to go to those cancer centers and being able to afford it. There's so many barriers as it relates to this. It shouldn't be so expensive to be able to go through treatment. And so I just wanted to, you know, thank you for, and thanking everybody on this panel for being vulnerable, for sharing at different stages of where you are. We have two women on here who within the past 3 weeks have undergone both double mastectomies. We have a pre-viver on who to share your experience of what you did as a preemptive, you know, measures. We have a survivor on to be able to share about what she went through and how she's using her voice and continuing to push forward. And we have you, Se-Nita, on too, and your journey and being able to now take that experience at your new role to be able to really shift and change lives in that space. So just, you know, thank you all. I wanted to open it up the floor to everyone. I know I have you all pinned, but since we have, you know, about like 13 minutes left worth of time, I just wanted to open it up if anyone has any comments, questions, conversation that you'd like to share. I know I have a few questions, but I want to open it up to those who are on the call first before I ask those. So, okay. If you'd like, oh yeah, go ahead, LaMarr.
Did Erika put how we may get her book? Is that in our chat? I didn't.
Yeah, I think I put it in there.
Okay, good. I didn't look. I just
Okay.
wanted to make sure that you did.
Yeah, I think
Okay,
you'll have
great.
to look for it though before we get off the call or it disappears. So
Okay, I will do that for sure. All right.
yeah, it's in there. Thanks though. Thank you.
That was one question. Yeah.
Yes. Any other questions? Yeah, Meg. Yeah.
Hey, very moved by all of your journeys and bravery. Well, I don't even like that word bravery, just speaking your truth. I wanted to know about the Keytruda and getting it after the fact. Like, what advice would you give women who been diagnosed with triple negative? They don't know about Keytruda. They've already been through their chemo. How do they go about having that kind of conversation with their doctor and then try and get that approved if it's something that they want to do after the fact?
So for me, one thing that I would recommend, because I think it is all about the practice that you're at. So for example, your doctor would have to get approval from the whole entire practice to make that available, because that's what happened for me, is that she had to present it to the team to make sure that care was approved by all, the whole team. Now, every practice may look different, but that was the process that I went through. And I think it's also about just having a conversation and bringing it up to them, because sometimes, even in clinical trials, you may not be offered that, but if you are a person who raises your hand, then that's an opportunity for them to listen to you and you to be seen and heard. So I think that bringing that conversation up, also, when you hear people who have done it before, then they hear that, hey, I know someone who has done that. Can we try that? I've heard multiple women now. And even if you do a little research yourself, Google is not for me, I don't like to Google a lot of stuff, but looking it up and just bring in some of the things that you've heard, because I know there's articles out there that I've seen in certain groups. For example, I'm a part of the Breast Cancer Baddies Facebook group, and they used to drop articles about Keytruda being approved for triple negative. So I think that for me would be the advice to go.
Yeah, and can I add something to off of what Se-Nita was saying? So I put in a chat, and I know Se-Nita, I had reached out to you. So, but anyway, I have an actual outside opinion appointment coming up with MSK because of Se-Nita, talking to her. So networking is good because I just want to get that additional opinion, because it really also depends on your institution and your oncologist, like she said, because your oncologist may be more rigid, and if there is no clinical data to support where you are, then some oncologists will be like, no, because I don't have anything that's evidence-based to add Keytruda to your treatment regimen at this point. But the way that Keytruda works is like it has to attach to something to be, more effective. So that's the reason why the oncologists, after the fact, they did a tumor board on my situation, because I filed a whole medical grievance about that oncologist not giving me the Keytruda beforehand. And so they did a tumor board, and they had a split decision where I am here in DC. So she kind of left it up. She basically allowed me to advocate for myself, and was like, well, listen, you made a good point for it. I'm going to still, she had to authorize within 24 hours. And listen, we can start after your PET scan, sort of thing. So there are some trials that I looked up in regards to this, and a lot of them were metastatic patients as far as receiving Keytruda as monotherapy or standalone therapy. So, so it wasn't anything really to support someone who was non-metastatic. But then there are 3 trials that are being conducted at MSK right now, that that's why I'm meeting with them in 2 weeks with the principal investigator, because I want to know if I can be enrolled in that trial. So at this point, in the future, maybe next year, you will have the data, to support adding Keytruda after the fact. So, I think it's important to talk to people and, talk to people in the support groups, and I'm more mentally stable to do it now. I wasn't equipped to do it before, but just talk to your doctor about it and do your own research. Another thing too that I found out about more recently was Se-Nita testing. I don't know if you guys have heard about that, but it's like a circulating tumor blood test where they take your original tumor, and they test that, and then they compare it to your blood. And it's kind of like a test it can be done like every 3 months, I believe, to kind of show, okay, or predicting a possible relapse or a reoccurrence. And so that's a newer test, is not federally approved yet. So if you have like a federal insurance like Medicaid or Medicare, they may not pay for it. But if you have a commercial insurance or PPO, you shouldn't have a problem getting the test. But I'm going to get the test. I already asked them to get it. And if they don't get it, I'm gonna find a way to get it done. So so I just think for TNBC people specifically, we don't have a whole lot of drugs available for our disease. So I feel like we got to throw everything, including the kitchen sink, at it. So that's where I'm at with it. So I'm going to start the Keytruda. I'm going to be basically a clinical trial within myself, because I'm going to be doing this along with radiation, and then I'll start Xeloda after radiation. But it'll be a clinical trial within myself, and sort of speaking, if there's any side effects or toxicity levels, my doctor's going to be monitoring, I'm going to be monitoring. And then for any situation, I think you always have to weigh the risk benefit situation,
Are you going to be taking at the same time as the radiation? Or because how you do chemo, then you would do radiation. Are you taking that at the same time then?
Yes, I'm going to
Okay.
start Keytruda, I think April 9th, something like that, like beginning of April. And then I don't know exactly when they're going to start radiation yet, because I'm not technically healed yet. So I don't know when they're going to start me on radiation, but it's going to
Overlap.
Yeah, it's going to overlap. And then once I'm done with radiation, then they will start Xeloda, because I did have some residual disease. Even though I had a good response to chemo, my tumor shrunk down to like from 5.5 centimeters to 1 centimeter, which is awesome. And there was no cancer found in all 26 nodes that were removed. I still technically have residual disease. So, and so that just kind of makes me think, what the study's showing, like if Keytruda would have been added, then it would have been, I could have had a complete response, but there's no way I can know that now. But the data that's out there shows that it was more promising that I could have had a complete response. So yeah, but here I am.
Hey, Latoya, do you know, do they offer Keytruda for people that do have past complete response? Or is it just?
I would say that I don't think so.
I don't think so, yeah.
And also, the way I was explained was that because I was in the crossroads of, like, literally my surgery was like July the 19th, and then Keytruda got approved like July 27th. And that's the only reason why I was able to do it, outside of being like how she's fighting to get into it. That's the only reason why, because my oncologist was like, because you're in the crossroads, like this, like we have to move forward in this period, because if it was like 3 weeks later, then I wouldn't have been offered that. So I think that if you're finished with treatment, it might be harder to do it.
Yeah.
And also to what Latoya was saying is that it's more promising when you do it with chemo. So the fact that I was doing Xeloda or, that I started Zalota. And I just finished Zalota last Sunday. So the 6 months was but I did it.
Yeah. Yeah. And see,
Yeah.
technically I'll be taking the Keytruda with Zalota because I'll be on Zalota for a year. I mean, Keytruda for a year and the Zalota's was 6 months. So I'll still have chemotherapy in my body, but it was studied with neoadjuvant chemo. It wasn't studied with Zalota or those oral chemotherapies. It was studied with, the red double, the Cytoxan, all of those, the neoadjuvant chemo. So that's the thing. So that's the reason why, trials are so important and, and that sort of thing. I think another thing, if you wanted to make an argument about, okay, I don't know the length of time when you completed the treatment, is if your tumor was PD-L1 positive or not. But if you have TNBC and you're stage 2 to 3, irregardless of your PD-L1 positive status, you still get Keytruda, at this point as part of the key 522 protocol. So I would just say talk to your doctor.
Yeah.
Talk
No, I
the
was just
truth.
curious.
Yeah.
Yeah, I was just curious because I finished chemo July 9th and then I had my mastectomy August 6th. So they didn't know I was gonna have the complete response, which I did, but no one offered me Keytruda. And that, you just get stressed out about it. Like,
Yeah,
oh, no.
you do get stressed. And I was diagnosed the same day Keytruda was approved, FDA approved, and didn't even know it.
Come on, that's crazy.
Yeah.
Wow.
Well, I wanted to thank everyone real quick too, because you all have been really informative. I'm excited to connect more with you, Latoya.
Yeah, absolutely.
Thank you. Yes, Erin, I just want to echo what Erin was saying too, to thank you all for this conversation, for being here and sharing about your experiences, as well as this, just a lot of information, tons of information, great advice as it relates to Keytruda, as it relates to what your experiences have been, what we need to advocate for as well, and speaking up and speaking out as well. I know that I wrote in the chat, but I'll open up as well. If there are any areas, I know that even from this conversation, I think that there are several that have come to mind just from what we need to advocate for on a larger level, like the fact that Latoya is going to be doing a clinical trial in herself. Like there needs to be more access to clinical trials on TNBC, and it should be more prevalent that you don't have to go through all those steps to even, thankfully, to be able to get this treatment. So if there are other areas that you would also like for us to advocate for, please either write it in the chat or you can send me a message about it, so that we can definitely make sure to work together towards moving some of these issues forward. As well as I just wanted to invite you all to come to our Hill Day next month, April 28th, where we will be talking about the survivorship bill and sort of understanding more about that, the plan for it and the coalition. So if you want to get involved, that's another way. And then also, I did put everyone's IG, Instagram, but if there's specific individuals, I know from the patient experts, if you guys want to share your email addresses or you want to share that so people can get in touch with you to follow up, please do so in the chat so that they can do that. I know that we have some women in the DMV who are going through similar experiences. I know that Latoya and LaMarr both had their double mastectomies 3 weeks ago together. So they are now they have breasties, they're connecting and they're there to be able to connect. So this space is also for that kind of connection, to be able to have those conversations. So I just wanted to thank you all for being here. Thank you to our amazing panel for sharing your stories. I know this is some of your first times, but this will not be the last. You all rocked it. So excited for what's next to come. We'll be having next month, our PullUpASeat conversation is going to be on bone health, and as it relates to bone health and cancer. So, and just the impacts that it can have with bone density and all. So stay tuned for that. You'll be on the lookout through our social media channels for that. But everyone who's on here will also get an email that I'll share so you can register for it. Again, thank you all for being here. Have a great and blessed rest of the weekend, and make sure to copy everyone's email and information. I'll share that as well. And this recording will be put on our YouTube channel so you can look at it and review it and share it with your friends. friends, family, and loved ones. So take care. Have a great rest of your day.
Bye,
Bye.
ladies. Great sharing
Bye-bye.
with